the other symptom that we notice is really inflammatory acne, and it tends to congregate along the chin and jawline and along the neck. These women can also break out across their shoulders and backs, even their chests. And both of those symptoms, the hirsutism and the inflammatory acne, are really driven by excess androgens. And androgens are our more male characteristic hormones.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. Welcome to this week's episode of the Radical Health Rebel podcast. Today, I had the pleasure of speaking with Kerry Jenkins, a board-certified physician's assistant and functional medicine certified practitioner specializing in dermatology. Our conversation focused on the often overlooked connection between Polycystic Ovarian Syndrome, or PCOS, and acne. Despite the complexity of these conditions, Kerry provided straightforward and practical advice for individuals struggling with both PCOS and acne. Stay tuned to learn more about how you can effectively reverse PCOS and acne. Kerry Jenkins, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thanks so much for having me.
It's great to have you here, Kerry. And to kick things off, could you perhaps share your academic and professional background and how you became involved in helping with women with polycystic ovarian syndrome and also acne as well?
Absolutely. So I am trained as a physician assistant, and I had the absolute luck to go into the specialty of dermatology straight out of graduating PA school. So I have been practicing dermatology for 24 years. And I would say, and in regards to PCOS, I began noticing somewhere around the 12, 13, 14 year mark that I was seeing a lot of young women that would come in with these cluster of symptoms. And I noticed that they were being sent to different places to address this cluster of symptoms. And I kind of zoomed out a little bit and allowed myself to think, what is really going on here? And I started just really being inquisitive and curious. And I started asking my patients a lot of questions. And when it dawned on me that this was really what was going on, these women would come in with acne, lower portion of their face, their chin, their jawline, on their neck. They were dealing with hirsutism, which is they were having hair growth in actually a beard-like distribution on their faces. They were having difficulty losing weight. They were shedding, their scalp hair was shedding. And a lot of them didn't have consistent cycles. And when I started asking them these questions and just engaging with them, it became very clear what was going on. And I just started doing the best I could to educate them and say, hey, this may be what's going on. I'd love for you to have a conversation with your gynecologist or your primary care physician, and maybe let's do some lab work and figure out what's going on. So that's kind of how it evolved for me, tying everything, all those cluster of symptoms together to really identify that the acne that I was seeing wasn't just acne.
Mm. Yeah, just one thing. So in the UK, we don't have a physician's assistant. Can you just explain what that is to the UK audience?
Absolutely. So do you all have nurse practitioners?
Yeah.
Okay, so we're very, very similar to a nurse practitioner. We practice autonomously. The only difference between a nurse practitioner and a PA is the nurse practitioners go to nursing school and they go all the way up, bachelor's, master's, doctorate in nursing. And PAs are with the medical students in medical school. So I was in class with the osteopathic physicians in my PA program. So we're trained the way physicians are trained. The nurses are trained in the nursing model, but we are both autonomous practicing providers and practice medicine.
Okay, cool. And for people that don't know what polycystic ovarian syndrome is, or PCOS, can you perhaps explain what that is, what causes it, and how it's related to acne?
Absolutely. So PCOS is an umbrella term. It's a cluster of symptoms that a lot of young females, young women, even through mature 40-year-old women, they experience a clustering of symptoms. And the most common are the hirsutism that we see. This is accentuated hair growth, and we see it in a beard like pattern on females. They will have hair growth on their upper lip, along their jawline, along their neck. They may have hair growth on their chest, and these are dark, coarse terminal hairs. This is not peach fuzz. This is hair that these ladies are having to address. They're having to get rid of it in some fashion, whether they're shaving or using a depilatory or threading or waxing or however they're choosing to go about eliminating the hair on their face. They're growing hair much like a man would. So that's one primary symptom. The other symptom that we notice is really inflammatory acne, and it tends to congregate along the chin and jawline and along the neck. These women can also break out across their shoulders and backs, even their chests. And both of those symptoms, the hirsutism and the inflammatory acne, are really driven by excess androgens. And androgens are our more male characteristic hormones. We as females have androgen hormones, just like males do, just in different quantities. But in women that have polycystic ovarian syndrome, the levels of androgen hormones are definitely upregulated. And that is what is manifested on the skin with the acne and the hair growth. Ultimately, polycystic ovarian syndrome is a metabolic dysregulation. So it's really about balancing blood sugar and insulin. Women that have polycystic ovarian syndrome have high levels of insulin, which is in turn triggering these androgens and manifesting these symptoms. So other symptoms that are commonly seen is they start to have a little bit of temporal hair loss. They will actually notice some hair shedding in their temporal region, much like a male will experience with male pattern baldness.
Bit like me,
Um,
you mean?
maybe a little bit, yeah. You have that little bit of hair recession. So they'll notice that the hair on their head, they're losing their scalp hair and they're growing hair in places that the last thing they want to do is have to shave every day. So they notice this paradoxical hair loss and hair growth. They often experience weight loss resistance primarily around their midsection, so around their tummy and hip area. They find it very difficult to shed that last 10, 15 pounds if they're trying to, drop some weight. Those areas tend to really hold on to that excess weight. They experience anxiety and depression, with all of the symptoms that are manifesting. It affects their self-confidence and their self-esteem, and it really is it's a systemic process.
Yeah. Do you know, in your research, or from your experience, what would you say is the actual causes of polycystic ovarian syndrome?
Well, the root cause, which is what we aim to uncover in an integrative and functional medicine practice, really is that insulin and glucose dysregulation. So, what's driving that blood sugar and insulin imbalance really comes down to our lifestyle. It comes down to what are the foods that we are choosing to eat on a day over day basis. Oftentimes, we always say here in the States, we call it the SAD diet, and that stands for Standard American Diet. And the Standard American Diet often is full of fast foods, processed foods, comfort foods, foods that are not necessarily really giving our body the nutrition that it needs to be healthy. So these fast foods, these processed foods, they're very high in sugar, they're high in preservatives, they're full of food colorings, um, you know, wheat, gluten, these comfort foods like breads and pastas and pizzas. These types of foods are full of empty calories, and they're not really giving our bodies the nutrients that our body needs to be able to make our cellular processes functional optimally. So when we get stuck into the standard American diet or a SAD diet and we're eating processed junk fast foods continuously, I find that that really is one of the primary root causes or driving factors behind polycystic ovarian syndrome.
Mm. Yeah, I know one of the things that I've heard as well as the foods that you mentioned as well, is things like seed oils and vegetable oils that are quite inflammatory as well. Would you agree with that?
100%. And the truth of that is that those inflammatory oils are what the processed and the fast foods and the junk foods are full of.
Mm.
So those inflammatory omega-6s, the canolas, the vegetables, the corn, the peanut oils, all of those are very, very, very inflammatory in the body. And processed, fast food, that's what those oils are very inexpensive. And the companies that are, creating fast food, they're going to buy those inexpensive seed oils to keep costs down. And when we consume those foods, it shoots inflammation through the roof. So for sure.
Yeah, it's interesting because, well, I don't know about more recently, but I remember I was in the US, well, maybe 10 years ago now. Yeah, probably around somewhere around 10 years ago, maybe more. And I would go to places like Whole Foods or in California, as I was then, Jimbo's, which is similar to Whole Foods. And I would buy, like, I'd go to the deli counter and I'd buy something like I don't know, like a chicken salad or something, and I'd take that with me and have it for lunch. And after I'd been there about 3 or 4 days, my tummy started to get really painful and gassy, and my bowel movements weren't great. And I was thinking, what's going on? Because all I'm eating is, like, chicken or some fish and a salad. And one of the guys I was working with said, "What oils are in that?" And I remember looking at the label and I said, "Oh, it says canola oil. What's that?" Because I don't think we even had it in the UK then. I'm not even sure if we do now, to be honest. And he said, "That's probably what's doing it." So I stopped buying that for lunch every day. And within about 3 or 4 days, funnily enough, I flew to Miami straight from there. And when I got to Miami, the Whole Foods in Miami were doing red meat at their deli, and they didn't have canola oil in their salads and things like that. And as quickly as my gut went south, as quickly it turned back round again as soon as I stopped having the canola. So that was a real eye-opening kind of moment for me. And I'm just talking about a few days of canola oil. Imagine if people are eating that 2-3 times a day for year on year. That's going to cause a horrendous effect.
It is. And I really appreciate you sharing that example. It shows just how in tune with your body's responses you were.
Mm.
And the one thing that I will say is that oftentimes people aren't paying attention to the clues that their body is giving them that it may not like
Mm.
what they're eating. You experienced gas and distension and bloating and discomfort, and oftentimes people just brush that aside and they don't stop and take notice and say, what are these symptoms trying to tell me? Your body's very clearly communicating it to you. But if you ignore it day over day, week over week, month over month, and you continue down the same road, that's where, systemically speaking, now we have many organs that are dysregulated. This is where disease really comes from.
Mm. Yeah. Yeah, it's interesting. As you were speaking earlier as well, I was kind of thinking, when you were talking about, the mental health effects of polycystic ovaries, for a female, they got, they're growing a beard or chest hair and they got acne, that makes you feel absolutely awful. But then what do a lot of people do when they want an emotional uplift? They go and buy the exact
Exactly.
same foods that you were just mentioning. And now all of a sudden they're in a vicious circle that for a lot of people can be very difficult to get out of, because that's their only comfort is the food that they're eating, but it's the food that they're eating that's causing the problem.
Correct. Correct. And it's exactly like you say. They're looking for comfort to feel better because they feel so bad about themselves.
Mm,
And it just continually drives the process. And this is where people, in the integrative and functional medicine space and the health coaches and all the people, we're trying to get the awareness out there. We're trying to get the education out there so that people understand what exactly is happening. And we've got to come up with variety of options, more tools in our toolbox for when people are feeling low and they're wanting to hide because their skin is a train wreck and they don't want to be seen and they don't want to go out. They don't want to hang out with their friends. And these women, every morning they wake up, the very first thing that they're going to do is check where
mhm,
is their hair that I need to get rid of so that my significant other, my partner, doesn't see it. You think about the level of stress that induces every single day, which is spiking cortisol levels in their body because of the stress that it's causing. And when cortisol levels are spiked, so is insulin.
mm,
So again, it's the mental, emotional, spiritual portion that's being affected, and then the physiologic response that the body's having due to that emotional stress. Again, it's another forward feeding cycle
mm,
that's just repeating the same problem.
mm. Yeah, and what you're describing there is, someone has emotional discomfort, but they're trying to treat it physically. When what they yes, they need to treat it physically, but in a different way, right? In a way that's positive rather than self-perpetuating. But at the point where, they've got PCOS, they've got acne, they've got this facial and body hair, yeah, they almost certainly do need some kind of emotional support. But I would suggest that needs to be at the emotional level rather than at the physical level. Yes, you can do things like exercise might make you feel better. You might actually eat healthier and it will almost certainly make you feel better, because obviously the other thing that's an issue, if you're eating those foods, as was the case in my experience, it massively affects your gut microbiome as well. And now if you affect your gut microbiome, we know because of the gut brain axis, it also affects your mood and it can cause depression and anxiety. So it's one huge vicious cycle, isn't it?
It is on so many different levels, metabolically, gut microbiome, the gut brain axis, the feedback loop to the brain. If you're eating inflammatory foods, if the gut is on fire, the brain is on fire. And when the brain is on fire, you are experiencing anxiety and depression. So, the purity of trying to get education and awareness out there for women to say, let me just take a quick quiz. I have this symptom. I have this symptom. I have this symptom. I could potentially have polycystic ovaries. And what can I do about it? What options do I have to where I could potentially reverse this syndrome, this constellation of syndromes?
Mm,
So, getting the awareness and the education out there is really the mission that we're on,
mm,
just trying to get people to be more aware, and to be able to advocate for themselves when they do go see a healthcare provider, to advocate for themselves, and really just understand that they have the power. We just need to educate them on how to change their lifestyle, and these are big changes. So this is where having a group support in community can be so beneficial. But we're just trying to raise awareness to get women to understand you can advocate for your health. We can educate you on what are good choices, what are better choices, what are poor choices, and listen, we're not looking for perfection every day. We're just looking for you to be able to make better choices, and consistently over time, making better choices can change the whole dynamic.
Mm. Yeah, that's so true. And the one thing I mean, you alluded to it yourself, but I would just kind of emphasize, yes, people need the education, but, in my experience as a practitioner of 28 years, having the right knowledge isn't often enough, because the person still needs to make changes in their lifestyle. And we know as human beings, we generally have resistance to change, even if that change will make you a much happier person. Because what I certainly find is people get into their comfort zone, and their comfort zone might be eating the junk food, having takeaway foods, not having to prepare your own foods, cook your own foods. And what I say to my clients, and I say it to students that I teach, no one's ever achieved anything amazing by remaining in their comfort zone. If you want to achieve something amazing, you've got to step out of your comfort zone, and you've got to start feeling comfortable being uncomfortable. And that's for me is the most important part of any process like this, is actually doing the things that you need to do to be successful. Yes, you need the right information, but a lot of people need support to be able to go through that uncomfortable period of change, because it is uncomfortable, right? Some people do it easier than others, but most people, in my experience, require a lot of hand holding and a lot of, motivation. And, some of the things that I do with people, I get them. So when someone works with me, the first hour they work with me, they're spending an hour setting their goals. That is it, for a whole hour, just to set your goals, because it's not just about, okay, what do you want to achieve? It's understanding your why. Why do you want to achieve that? Because there's going to be times when it's tough, and it's very easy to throw the towel in and say, oh, I can't do this anymore. But if you continually remember your why are you doing it? It helps you to continue doing the processes that you need to do to be successful. So I just wanted to add that little bit in there.
So very well said. Absolutely. The community factor, I personally feel the community factor is either going to make you, or if you don't have community of like-minded people that are experiencing similar things, that have the same goals, if you can put a person in a community that supports them so much more, because like you said, change is difficult. And if you go through it together and you can support one another and you can celebrate your wins and you can share your fails, because we are all human. And like we said, we're not looking for perfection. We're just looking to make better choices consistently. If you can share your wins and share your challenges and receive support, what is that saying? The rising tide lifts all ships, right? So that community component is really exceptional when you put people together and bring them through a program to try to educate them, and allow them to understand what's going on in their body and how to make changes to allow their body to heal. The goals are so incredibly important because, like you said, when the going gets tough, it's very simple to say, you know what, I bit off more than I can chew. This really isn't going to work for me. I'm failing and I'm just going to stop trying. If you can come back to why you want it, and it's solid within you, your why, it allows you to fight another day, right?
Mm. Yeah. Yeah. I mean, the one thing I would add to that people do need to be careful of in a group situation is that misery loves company too. So you just have to be careful that, you can have a positive effect in a group, but you can also have a negative effect. So you just need, things in place to make sure that that doesn't happen.
Yeah.
The other thing I kind of picked up on when you were speaking there as well is you said to share your failures. And what I get across to my clients is there's no such thing as failure, only feedback. So, if you do something for, my failure, let's call it, was to have canola oil. That gave me great feedback, right? My tummy felt awful. And the great thing about feedback is it gives you an opportunity to learn. So failure is fine. There's no problem. No, failing is not a bad thing. As long as you don't keep making the same mistake, then it is a problem.
Right.
But
it's education. It's knowledge. It's knowledge.
And sometimes we make our greatest gains from our biggest failures as well.
Very true.
Question I've got for you, I'm just curious. From your own experience, how common is acne in people that you see with PCOS? Litsa was a 30-year-old professional woman suffering from severe acne and scarring. She was in utter despair and didn't know where to turn. She worried her partner might leave her because of her skin. And Litsa's condition was as bad as I have ever seen. Following testing, it was found that Litsa had toxoplasma, as well as food sensitivities to gluten and soy. Litsa was a great client to work with. She jumped in and followed the program almost 100% to the letter. She cut out the foods that she was sensitive to. She had infrared saunas as advised and used the recommended essential oils. After working with me, Litsa reported how much her skin had improved and how she now had much more confidence. She has also gone on to marry her partner and started a family. If you're ready to say goodbye to adult acne for good, schedule your acne breakthrough call with me now at www.eliminateadultacne.com and let's create a customized plan for clear, beautiful skin that lasts a lifetime. Don't wait any longer. Take control of your skin today.
I would say 90+%
Wow.
of the women that have PCOS are dealing with acne. And it's not just one blemish. It's angry and red and inflamed, and they're trying to hide it and cover it up. And it's a very, very big process trying to manage that.
Mm. And how many, well, this is probably a difficult question to answer, but you can maybe have a stab at it. How many people or women have acne, do you think, who have PCOS but don't know it?
That is a very good question. And I don't know that I could put a numerical value on that. Sometimes acne is just acne. Acne is typically, especially in the States, it's tied to puberty. When those hormones, those androgenic hormones are being turned on by the pituitary to the ovaries, the pituitary to the testes, that's when acne gets turned on. Sometimes that's all it is. But acne also has underlying and root causes. So the turning on of the hormones, that's one cause. Typically, these pubescent teenagers are consuming a diet full of the comfort foods, the processed foods, the fast foods, the industrial seed oils, all the things. That is another driver, a root cause of acne. So there are multiple root causes for acne. But in women in the age group of 17 to 30, there can be other symptoms of PCOS that really it is PCOS. So women don't have to have a full beard, crazy inflammatory acne, hair loss. They don't have to have all those symptoms, weight loss resistance, to have polycystic ovaries. There are very slender, lanky females that are not ovulating every month, that have dysregulated hormones and dysregulated blood sugar and insulin, that have polycystic ovaries. So you don't have to have acne to have PCOS. Many women who have acne do have PCOS, but I would not be able to put a percentage of how many women that just have acne also do have PCOS.
Mm. Yeah, I knew that was a tough question to ask, because how, it'd be very difficult to calculate, wouldn't it, really, unless you ran some tests on the whole population. It'd be very difficult. But I've just got this suspicion that there are probably a lot of women out there who are really suffering with acne, that have polycystic ovary syndrome and don't know it. But the interesting thing is, again, if you look at, okay, what causes acne, what causes PCOS, it's pretty much the same thing.
They're very similar. They are very, very similar. And PCOS is along the continuum, right? If you think about it as a scale, it's further right on the scale. It's a continuum. So women that suffer with acne, like we say, they get into these vicious cycles with the food choices that they're making, which ultimately give inflammation in their gastrointestinal system, which feeds back to their brain and makes them anxious and depressed. And when there's that level of systemic inflammation in the body, it dysregulates your metabolic system. So a female can just start with acne and then continue on that scale and eventually develop full-blown PCOS because of their food choices, because of their sedentary lifestyle, because of their inability to have a very good, consistent circadian rhythm, right? So there can be a lot of lifestyle factors that push the process of developing PCOS, where, had certain things been in place, good circadian rhythms, really healthy food, consistently moving their body every single day, managing their stress. If those lifestyle, if they manage their lifestyle, they may not progress to full blown PCOS. So it's a continuum.
Right. Okay, that's interesting. I'd never actually looked at it that way, but I can see that makes complete sense. What kind of tests do you run if you suspect PCOS, and what test might you run if they come to you with acne but no PCOS diagnosis?
So we can get a lot of information from regular blood markers. We can measure a complete metabolic panel, which is looking at fasting glucose, liver and kidney function. I always get a fasting insulin on all of my females that have acne that I'm considering PCOS. Like we mentioned in the very beginning, we're looking at fasting glucose and insulin. We want them to be balanced. And in women with PCOS, they often have insulin resistance, meaning because of the food choices that they make, they have high elevated glucose when they eat processed packaged foods that are very high in sugar. And then, boom, they're going to have a very high spike of insulin right after the intake of those foods. When you have a spike of glucose, you have a spike of insulin that follows. So we do a complete metabolic panel. We're looking at fasting insulin. We're going to look at hemoglobin A1C, which is a glycosated marker to show us how sugarified the red blood cells are. Hemoglobin A1C is a marker that we typically use when we're diagnosing diabetes, pre-diabetes or diabetes. So again, it's looking at that metabolic process. And then we can also take a look at female sex hormones. So we can look at levels of estrogen, progesterone, sex hormone binding globulin, testosterone, free and total testosterone, and DHEA. So we can look at sex hormones, we can look at metabolic markers and really get an indication of what's going on with that person systemically. And those are really easy labs to get. They're relatively affordable. Any practitioner that has a medical license can order them. They don't have to be. They should be done fasting to get a good fasting insulin. So a person can just plan to go to the lab and get them done, and that's the beginning of the workup essentially.
Mm. So that's all blood you use.
Yep, we use blood. There are other more advanced diagnostic testing that we can do, that we can measure hormone levels in saliva. We can measure hormone levels through urine. There are different types of testing methodologies to get information like that, but simple blood work is easily attainable and affordable. And a lot of times insurance will cover that.
Yeah. Yeah. So is that pretty much all you run? Is that all the testing that you would do for someone with potentially PCOS?
Yep, that's a great place to start.
Okay. Interesting. And I know we mentioned it earlier when we were talking about mental health, but for you, how important is gut health when it comes to acne?
It's everything. It's absolutely everything. So, like you mentioned, our gut microbiome, and I'm sure your listeners are very well educated, but essentially we are more microbe than we are human. There are more microbial cells in our gastrointestinal system than there are human cells in our entire body. And take a minute and really let that sink in. We as adults carry between 3 and 6 pounds of microbes inside of our gastrointestinal tract. And those microbes live commensally with us, which means we provide them a warm, safe, stable environment, and they help contribute to our health or our lack of health. If our gut microbiome is healthy, then our bodies are healthy, our brains are healthy. If our gut microbiome is out of whack and we have more of the opportunistic microbes, yeast, parasites, dysbiotic bacterial microbes, if there is a dysbiosis where the balance is not even and there's more dysbiotic microbes, then our body is not healthy. So when I'm working with a person, whether they have just acne or they have full-blown PCOS, which is more of a metabolic process, we are always starting in the gut. And we want to take a look at their lifestyle. What are they eating? When are they eating it? Because it's not just a matter of the foods that they're choosing, but the time of day that they're having those foods. So we want to talk to them about, how much fiber are you getting every single day? How many servings of fruits and vegetables are you putting on your plate or having for a snack every single day? What time of day are you eating? Is there a lot of late night eating habits that have slowly evolved over time? This is where that kind of, comfort, I'm feeling bad, so I'm going to have, a dessert or a sweet treat to make myself feel better. And that often happens after dinner, late at night. That is absolute metabolic mayhem, spiking glucose, spiking insulin late at night. It's driving inflammation. So the gut microbes really, really are driving the bus on whether we're healthy or whether we're not healthy. So we put a very, very strong focus on identifying behaviors and food choices that are going to help support our good gut bugs, because supporting them in turn supports us.
Mm. Yeah, it's interesting. You probably don't know my story, but I had severe acne for 18 years. And at the point where I kind of had my aha moment, I went to see I was in a lecture in a university, and this guy was speaking, and all these light bulbs were coming on because my doctor had told me for 18 years that acne had nothing to do with diet. And here's another antibiotic, keep taking the antibiotics, which weren't working. And anyway, I went to see this Chinese guy, and he ran these tests on me, and he said, first thing you got to do is stop taking those antibiotics. And my first thought was, oh, but my skin's going to get so much worse if I stop taking them, right? He said, no, you've got a candida infection. He said, I need to put you on an antifungal protocol. And I was like, okay. And he said, and by the way, you're intolerant to all these foods. And he gave me a list of about 37 foods that I was intolerant to. So obviously I went on a very low sugar diet, or no sugar diet, pretty much. And after 18 years of severe acne, my skin cleared up in about 2 weeks.
What an amazing testament to the power of food. We promote food is medicine. Food is information for our body, right? And when we use it appropriately, magic can happen. And that's exactly what you experienced. You took away the foods that your body was not able to process or tolerate. You lowered inflammation. You swapped out the foods that your body was not doing well with healthy, whole, nutrient-dense food. And within 14 days, you're telling me your skin cleared. That is magic. There's so much power in that. Food is medicine, and we need to start educating our kids. And I mean, everybody needs to understand the power that our fork holds.
Yeah. And the other thing as well, I think it's important just to kind of re-emphasize, I was on antibiotics for 18 years, right? And we're just saying how important the gut microbiome is to your skin. And what do antibiotics do? They kill all the bacteria, the good and the bad.
Everything.
Right?
It's decimated.
So why did I have a candida infection, I wonder, if all the good bacteria weren't there, right?
Right.
So
those antibiotics are driving that candida infection.
Absolutely. So the other thing I just want to add, people listening to this and they've got acne, it doesn't mean that everyone can turn around their acne in 2 weeks. Everyone's different. And, I would say, in my experience, men do generally turn it around quicker than women. And I would say for most people, if you've got a good plan and you really follow it, 3 to 6 months is a good time scale for most people. But I say some guys I've worked with literally just change your diet and it can change really quickly. It just depends on, what your cause is. But, I was about to say, and it depends on how long you've had it, but I had acne for 18 years and I had it bad and it turned around for me pretty quick. I mean, I probably had a handful of breakouts over the next 10 years, but that was probably less than I would get in a week, Probably about 10 years after that, I've been pretty much acne free. But I also know if I do the wrong things, I will get a breakout, right? And now I haven't done it very often, but sometimes I do love kettle chips. Now, I know I don't do well with potatoes, and I certainly don't do well with the oils that come with them. If I eat a small bag, not a problem. But sometimes if I think, I really fancy some, and I go into a store, I've got into my head, I'm going to have some kettle chips now, but I'll buy a small bag and I'll be fine. And I go in there and there's no small bags, only family size. And then I say, I'll have some and I'll put them in the cupboard and I won't touch them for a while. And then I get home and you know what's going to happen. You can't stop eating them. You eat the whole thing. And then I sit there and think, I know what my skin's going to do tomorrow. Right. Mm-hmm. Mm-hmm. So, from everything we've said, it just shows how important what we eat does to our health and to our gut and to our skin, But I have not had any kettle chips for the last year, so I'm doing all right.
Full disclosure, no kettle chips.
Yeah. I mean, to be honest, if I go in somewhere now and they have a family size bag and I fancy some, I just wouldn't buy it.
Right. And they do that intentionally, right? they're flavor engineered. They're full of all of these chemicals, and I mean, I know you understand. We don't need to go into that level of detail, but but how powerful of a choice for you to claim your power and to say, I'm not going to buy that family size because I know what's going to happen. I'm just not going to have them, or I will substitute something else that does have a small size bag.
Yeah. Yeah. I kind of feel like I just wouldn't even feel like a whole bag anymore, because at the end of the day, you've got to weigh up the pros and the cons, right? What's the pros? Yeah, I like the taste. They taste really nice. I quite like eating something crunchy, like the texture. Do I want to break out tomorrow morning? No. I'd actually rather go hungry than have a breakout the next day,
Mm-hmm.
Not that it would bother me that much these days. Like, when I was young, it really bothered me. But now I know I'm in control. So
Yeah.
if I did have a breakout, I know A, it's not going to last very long, and B, I know what to do to stop it happening again. Right.
Mm-hmm.
So it's my choice. I'm a grown adult. If I'm going to make a mistake, I make the mistake consciously.
Yeah. There's a lot of power in that.
Yeah. And again, if I'm gonna eat a family sized bag of kettle chips, it's going to give me feedback.
It's going to give you feedback. Yeah.
Right.
It's going to give you feedback on your skin. It's going to give you feedback in your tummy.
Yeah.
It's going to give you feedback. Your brain will feel the effects of that.
Mm.
It's multifactorial.
Yeah, absolutely. Now, do you ever, because obviously we're talking about the gut, do you ever run stool tests on clients with acne?
I do. Every single client that I work with that has acne gets a stool analysis. We can gather so much information from these tests, and I also would like to disclose that these tests are not perfect. They're far from perfect. The technology that we have is amazing, but there's so much more that we don't know, and in 10 years we will understand. So we take the technology that we have right now and we use it knowing that it's a snapshot in time, and it's not giving us all the answers, but it gives us really, really great information on which microbes are present. Is there an overgrowth of opportunistic bacterial microbes? Is there an overgrowth of yeast? Is there an overgrowth? Is there a parasite present? You know, um, the stool analysis will help us understand how well the process of digestion is happening. Is the stomach really acidified to trigger the pancreas to release pancreatic enzymes, which then triggers the gallbladder to contract and release bile to break down fats? How well is that whole digestive process happening? It lets us know if there's elevated fat in the stool, if there's low pancreatic enzymes. It lets us know how much inflammation is present in the gut lumen, which again, we talked about affecting the brain and affecting everything systemically. It lets us know if there is any autoimmune process happening against one protein that's found in gluten. We measure anti-gliadin IgA. So if we have high levels of antibodies of that protein, we know that a person is gluten intolerant. So it lets us know so much information from a very non-invasive test that can be done at home. Very, very simple. So any person that starts working with us, we do a stool analysis straight away.
Yeah. Yeah, I thought you probably would. So if you have a lady, she comes to you, she's got PCOS, she's got acne, where would you kind of start the process with her? Holly was a 28-year-old personal trainer suffering from acne when she first came to see me. Holly had terrible breakouts and felt embarrassed and like a fraud when training her clients, as she didn't think she was the perfect example of what it meant to be healthy. Even though she was a personal trainer and was trained in nutrition, she didn't realize the foods that she ate was causing her acne and affected her overall health. Following a few lab tests, it was discovered that Holly had fungal and parasite infections, as well as food sensitivities to gluten, egg, and soy. Holly changed her diet as advised by following her metabolic typing diet, eliminating sensitive foods, and following a plan to reduce her fungal and parasite infections and to help heal her gut. The program worked to treat for Holly, and she was completely spot-free relatively quickly once the program was in full flow. She now has much more confidence, especially at work, enjoys her social life, and no longer has to wear makeup to go out of the house, which she really loves. If you're ready to say goodbye to adult acne for good, schedule your acne breakthrough call with me now at www.eliminateadultacne.com, and let's create a customized plan for clear, beautiful skin that lasts a lifetime. Don't wait any longer. Take control of your skin today.
Well, I have to be honest. I think I'm going to borrow. I'm going to take your lead, and I'm going to really spend enough time getting her to identify her why. What are her goals? Why does she want to achieve that? Because, like you said, it is so, so important. So, identifying the why. Let me know why you want to embark on this health journey. Getting the blood tests and getting the stool analysis, and start the conversation around the lifestyle piece that is so important to support our body. So when we talk about the lifestyle, we're talking about the choices that we have when it comes to fueling our body. What are we choosing to fuel ourselves? So the food that we eat, how much water are you drinking? Are you drinking water, or are you surviving on caffeine and soda pop? Right? What are you bringing in? So, talking about the nutritional piece. The next thing that's really important, that's a foundational portion, is how much movement are you getting every day? Are you living a sedentary lifestyle? Are you sitting at a desk for 8, 9 hours a day? Are you having a 45, 50-minute commute to and from work where you're sitting in your vehicle or sitting on the bus or sitting on the train? Are you coming home or picking up a packaged meal, sitting down to eat your meal, and then after your meal is over, sitting in front of the television, right? What kind of movement are you getting throughout your day? And how, if you're not getting enough, how can we sprinkle that in? Then the other big piece is, how well are you sleeping? Are you getting not only quantity, but what is the quality of your sleep? Is your body able to do its regenerative processes that it does when you're sleeping? If you're only getting 6 hours of sleep a night, that's not enough time. Let's talk about your stress. How's your nervous system? Are you managing your stress? Do you know when your body is feeling stress and what happens? Are you even aware and mindful of when it's happening throughout the day? And what tools do you have to be able to reduce that stress? So we're going to start talking about the foundations of health, the nutrition, the movement, the sleep, the stress management, and just trying to get a roadmap, essentially, of these are the things that are going to need to be put into place to get us to our destination. This is the journey, the health journey that we're going to take.
Mm-hmm. Yeah, it's interesting. You've just described the coaching model that I use, which is, it's called the 4-doctor model. I don't know if you're familiar with that.
I'm not. Tell me more.
So this was devised by Paul Chek, who's the founder of the Chek Institute in California. So the first one is Dr. Happy. So that's to do with, getting clear on what makes you happy in life. So when you said right off the bat, you need to understand why they want to do it. What's their why? That comes under Dr. Happy. Dr. Diet is about getting your food right for the individual, plus hydration, getting hydration right. And obviously, coffee, if you've got acne, is not a good idea, and neither are, fizzy drinks. Dr. Movement is all about exercise and getting the right kind of exercise in. Dr. Quiet is about sleep, rest, recovery, and I would put de-stressing in there as well. So you've just explained exactly the model that I use.
I love the names. I think that little play on words allows people to have a better understanding of what it is that we're trying to achieve. I think that
Mm.
that's fabulous.
Yeah, I was actually a guest on a podcast about an hour ago, and he was actually asking me the question about the four doctors. And the reason why Paul Chek developed the four doctors is actually originally it was Hippocrates' idea of three doctors, but he added doctor movement because 2,500 years ago everyone had to move just to survive anyway.
Mm.
But what I explained to him is that all the things that we've studied over the years, nutrition, I've studied a lot of exercise, endocrinology, whatever it might be, right? The gut microbiome, it's all very, very complex. But there is such a thing called the complexity simplicity curve. And what that basically is as you study more and more and more, all the concepts that you learn become more and more complex.
Mm.
But there comes a point where you hit the top of the bell curve because regardless of how complex the thing that you've learned, you've now got to teach a layperson to be able to do it. So you now have to package it into a very simple way. I would say that perhaps an 8-year-old or a 12-year-old can understand, even if you're talking to an adult, because they've not read hundreds of books like we have. They haven't spent thousands of hours in classrooms learning like we have, right? So whilst you've got all these very, very complex concepts, it has to be simple for the end user to actually do it.
So, so true. And what comes up for me is with the training and the education and the knowledge that we have spent years collecting, personally, I find that I need to take a step back and deliver the knowledge in bite-sized pieces because we have so much information we want to share, so much knowledge, so much teaching to do. But if we do too much too fast, all we're going to do is cause overwhelm and panic, and somebody's going to say, count me out, I can't do this, it's too much. So simplifying it and delivering it in bite-sized pieces is testament to the work for sure.
Mm. Is there anything else in particular you want to add that perhaps we haven't discussed around PCOS?
The one thing that I really want listeners to take away is that PCOS is a constellation of symptoms. It's a label for a constellation of symptoms. It is reversible. And really, it is a metabolic process. And that's what we need to target in order to get the body to function optimally. It's not just ovaries gone rogue. It's not ovaries mass producing follicles and having cysts. That's not the problem. The problem is the elevated androgens, the elevated insulin, the elevated cortisol that pushes the ovaries to have all of the cysts, which then cause all of the symptoms. So really, it's a metabolic process. And when we combat it from that angle, in implementing the four doctors, we can make magical things happen. It takes time. It's not going to be quick like a light switch. It takes time and it takes consistency. But with the right coach, practitioner supporting you, these changes are you can make these changes, you can sustain these changes and incorporate it into a whole new lifestyle, and you can reverse PCOS.
Mm.
I want to instill hope.
Yeah. Yeah. So the things that we mentioned around PCOS, so we mentioned the acne, the facial hair, the body hair, the increase in body weight, receding hairline, but it also has an effect on fertility as well, doesn't it?
PCOS is the number one cause of infertility in the United States, and it is not being talked about anywhere near enough to women of childbearing age to understand that this could be the root cause of their infertility.
Mm.
So it is the number one cause, yes.
Yeah. Awesome. So what's next for you, Kerry?
Well, we are looking to launch an online group program to help educate women how to make amazing choices and reverse PCOS. We're looking to launch this in the fall. Um, and, my hope is that by creating a online group program, that the community aspect will be integrated and we can all support one another and learn together. Like you said, failure is not a failure. It's more knowledge. It's more feedback. So just supporting one another and really letting women know it's common. It's more common than you can imagine. You're not the only one. And to inspire hope that you can make changes that can reverse the process.
Mm. Yeah, I mean, it really saddens me actually that you just reminded me of something. So, and again, I've mentioned this a lot on the podcast previously, but I see so many, mainly women, but men as well, posting on Facebook groups, like acne Facebook groups, and they just they've just got no hope. And the sad thing is as well, if I whenever I've got time, I will try and respond to them, but they often get angry at my response. You know, and it's difficult to give if you're just typing, it's very difficult to give a decent answer. But my I guess my answers are normally along the lines of, you know, you really need to be looking for the cause of the problem. There are natural solutions, and there are lots of people out there that can help you, and there are lots of books, self-help books that can help you as well. And sadly, it just gets met with aggression, and I'm not quite sure exactly. I think a lot of people have probably been let down by a lot of people previously, a lot of professionals, and I often see that the paradigm that they have is that there's got to be the magic bullet out there, the magic skin cream, the magic pill, the magic whatever it might be. And then when someone comes along and says, actually, if you change your diet, de-stress, go to bed earlier, get some movement in your body, it's almost like that's too simple an idea, and that couldn't possibly work because otherwise they would have tried it.
Mm-hmm.
You know, so it just really saddens me because it's very difficult to reach out properly and connect with those people. What would you say to, let's say, a woman who's, she's been through the ringer, feels like she's tried everything, nothing's worked. If anything, skin's got worse, and they feel that there isn't any hope out there. There isn't anyone out there that could help them. What would you say to someone like that?
Wow, I feel that
Mm.
heavy. I would ask them if they would be willing to try something different for 6 weeks. Would you be willing to commit to something for 6 weeks? Wholeheartedly, go all in 100%. Would you be able to commit to something for 6 weeks as an experiment to just try and see if this is capable of moving the needle for you? And I think by offering them the choice to say yes or no is powerful.
Mm.
And I think letting them know that I have seen amazing things happen in women who say yes and step up and accept a 6-week challenge. It's really hard, but I think that is how I would present an offer. I don't know if that would be received well or not, because I hear you saying the anger and the resentment and the lashing out, and it is because they've been burned and they've been promised things and they've been let down, and that's tragic. So how do you best support somebody like that? I think you just ask them, are you willing to try? Let's try together.
Mm. Yeah, it's interesting. Sometimes if I have got time, I will give a longer answer, and it's amazing how, like, I guess it's just the way the world is today. I just get attacked. This guy's a grifter. He's trying to sell us something. He's a shill, and I just say, I'm taking time out of my time to try and help you. I don't have anything to gain by, and I'm not saying, oh, by the way, I've got a book, self-help book on acne, and I've got a group coaching program. I'm just giving advice and leaving it at that. And I'm even saying, look, there's loads of people out there. There's loads of really good practitioners, because there are. I'm not saying, oh, come and work with me.
Right.
And even then, it's still like, oh, this guy's a grifter. This guy's trying to sell something, and it probably is because, like, they probably have been burnt before. But that's really sad. So before we go on that, I don't want to leave it on a low note. What would be your kind of passing final words of encouragement for women with PCOS and acne?
I think you just said it. There are amazing practitioners out there with hearts for healing people. You just have to know where to find them. You
Mm.
have to know how to search for them. You have to know what to look for. But there are so many gifted practitioners that really go into this type of work because they have a passion for people and they want to help.
Mm.
There is hope. It does take consistency. It does take change. And like we have said, change is difficult and uncomfortable. And you have to get to a point where you can be comfortable being uncomfortable and stepping outside your comfort zone. But there's hope. And there are lots of people that are willing to take your hand and work with you and support you along the journey. You just have to find the right people.
Mm. Yeah, what I find amazing as well is that, all of us that are working in this space, we're all saying the same thing. We all work in the same way because it works, right? It's not like, again, I don't want to bash someone, but if you went to a medical professional, it'd be, oh, use this product or use that product, or, oh, go to another doctor. Oh no, use this product or that product. And obviously they're chasing the symptoms, whereas we're treating the cause of the problem. But we've all got very much the same message. Very rarely do people in our space say anything different. We've realized today that we work in pretty much the same way, got the same philosophies, the same 4-doctor coaching model, even though you didn't know that's what it was.
Yes,
right?
I love it.
So, yeah, I think the message that we're both giving out there to people that are struggling with acne, that there is hope, there is help. And, the reason I wrote my book was because a lot of people were coming to me and I was offering them my coaching program, and they were just saying, I can't afford. I literally, I was having like, cleaners and people that worked in hotels and people like that with acne. They couldn't afford it. It wasn't that, they were trying to get a discount. They literally couldn't afford it. So I just thought, well, if I put everything in my book, step by step, that I would teach someone if they were my client, then okay, it's never going to be as good as working with someone, but it's the next best thing you can get. And it's, it's $20. Who can't afford a $20 book? And I'm going to say there are loads of other good acne self-help books as well. It's not just mine. And I've read a lot of them and they are really good. And they say a very similar thing to what's in my book, So yeah, I think we can end on a hopeful note that for anyone out there suffering with acne, there is help and there is a way, as long as you're ready to make some change and really commit and be in it for the long haul.
Beautifully said. Agree.
Kerry, thank you so much. I've really, really enjoyed chatting with you today, and I'm sure, people listening to this are really going to benefit from our discussion today.
Well, thank you so much for having me and for being part of the team and in educating and building awareness. It takes an army, and I think of it as an honor and a privilege to be a part of that community. And, you are part of that tribe. So thank you for doing what you do.
Awesome. And thank you. So that's all from Kerry and me for this week. But don't forget, you can join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.